Penny, are you going to chair or is Mary going to today?
I guess either way, I was hoping that if people were okay with it, or maybe we should talk about it at this meeting and do it at the next meeting if we want to elect a chair and vice chair. I know Mary's willing to. I'm happy to, but I think since we didn't do elections, if we want to do that really quickly at the beginning, did you talk to Kaki about it?
I did. I talked to Kaki and it's now on the agenda. I mean, it's on my agenda.
Okay.
So we're planning to, yes.
Okay. So in the past, what we did is when we had that as an item at the beginning of our meeting, Phyllis ran that, at least the times I can remember in the past, she would kick off the meeting, and then we'd elect the officer straight away, and then whoever's elected would run the rest of the meeting. So I'm fine to start the meeting though and just explain that we added that in and that we can take care of that. I think it's just, yeah, I think not having a member run the elections is always good, but it's, I mean, you know,
Yeah,
I don't think
Kaki
anyone should
doesn't
feel
really have
weird.
any clue. She doesn't have any clue on the way that advisory board runs yet. So she would probably be extremely happy if you.
Yeah, I figure I'll just start the meeting off and explain that we just need to take care of that, and we can do that right at the beginning, and then whoever's chair can do the minutes, and but I'll call us to order and stuff. That sound good?
Okay. Hi, Mary. Hi, Tammy. Hi, Natalie.
I'm going to be staying muted most of the time. I'm still at school and the kids aren't actually out of school until 4:05. So if I'm muted or talking to other people, then I'm trying to manage that. And then when they are gone, then I can be a little bit more talkative.
Hi, Amy.
Hi, everyone.
Hi, Emily. Kaki.
Hello.
Hi, everybody.
No.
All right, are we waiting for anyone else, or should we get started?
I think we can go ahead and get started.
Okay.
We are expecting a couple of other folks to join us, including Mary, Wanda, and Alice as they can.
Okay, well, we can get started with our other stuff before, and then hopefully they'll be with us by the time we get to that part.
Great.
I was gonna just call us to order and start off the meeting since technically I am the chair. And maybe what we should do just to keep things moving is we can go ahead and approve our minutes from there's the January minutes. Has everyone had a chance to look over the minutes? Any changes?
I did notice there was a part that was struck. it had a strikeout line through it, but it was still in there. So if you just want to make sure that it gets deleted before it gets saved or whatever, because I'm assuming that was something that you wanted to remove, Lisa, from the minutes.
Yes, it was something Khaki wanted to remove and I missed it, but I saw it today. So yes, it will be removed.
Okay. Besides that, I didn't see anything else.
Okay, so with that change, is there a motion to approve?
I will move that we approve the minutes.
Okay, who was that? Who's that?
Mary,
Mary, okay.
I'll second it.
and a second from Amy. So all in favor? Aye,
Aye.
yay. Great. All right, so January minutes are approved. And then one other item that I wanted to take up, and I think Lisa has researched this a little bit for me and spoke with Khaki. And typically at our January meeting, we would elect a chair and vice chair. And I wasn't there at the January meeting, and we didn't do that. And I'm happy to run that part of the meeting. I don't think it's like a contentious process. Typically at the beginning of the year in the past, Phyllis would just run that part and let people nominate a chair, and then we can vote on that, and then a vice chair. But I'm happy to run that part since I am the chair right now. And I guess just before we open it up for nominations, I want to thank Mary for being vice chair and for stepping in to actually chair when I was absent. And I have talked with Ann Malik about finding someone to replace my position, and I really want her to find someone before I step down. So I'm going to keep serving, and she's been looking for a while. If anyone has any ideas, send them to Ann or to me, and I can share that with her. But I was hoping within the next couple months that she might find a replacement, and then I would cycle off my role here on the advisory committee. So with that said, I guess I would be open to nominations for someone other than myself to be chair. And I have an idea of who I would nominate, but I'd like to hear from others. So
should we do introductions? Do we have any? Is
Oh,
there
yeah,
a new member today?
Yes, that's great. That's probably a better way to introduce everyone to this process. So Mary, do you want to go and start? And I think it's helpful if people say their supervisor's name, their district, and then whatever you want to share about yourself.
Sure. I am Mary McIntyre, and I just realized I need to rename myself because my name is not spelled right on my description of my picture. Okay, I fixed it. Mary McIntyre. I'm from the Rio district, and I've been on the board for 3 years, and I'm a teacher at Jack DeWitt Middle School. I'm a reading specialist.
Anybody, whatever order we want to go in, is fine.
I'll go next.
Okay, great.
I'm Emily Dodson. I'm in the Scottsville district, and I work at ARS in Charlottesville.
Great. Thank you, Emily.
I can go next. I'm Amy Loffer, Ravenna, and I'm staying at home with my kids.
Thank you, Amy.
I'm going to jump in here since nobody's jumping in.
Okay.
I'm not on the committee, but I'm Jim Andrews, a supervisor from Samuel Miller District. Catherine Burton has stepped down, but I am looking for someone from Samuel Miller to represent on this board. So I'm listening in a little bit today, and thank you.
Great. Thank you. Nice to meet you, Jim. Is there anyone else? I guess I'm not, some of the people here, I'm not sure if they're here just to do presentations. Is that everyone?
I'm Natalie Dietert, and I'm a new member from the Jewett District, and I am an adult education instructor of ESL and workplace skills at TJACE at PVCC.
Great. Thank you, Natalie. Nice to meet you.
Nice to meet you.
So I'll go. I'm Jenny Moore, and my supervisor is Ann Malik, and I represent the Whitehall District. I'm also on the Planning Commission, And then I am on a lot of other committees as part of my planning commission duties. I'm on the Historic Preservation Committee, liaison to that, and then the Albemarle County Easement Authority. And then I also manage my household and children in my spare time. So that's me. Okay. I guess should we wait and do other introductions before the item for the month? Or does everyone want to meet everybody right now?
Let's do everybody right now, and then we don't have to do it as we're going.
Yeah.
I'm Kaki Dimmick, and I'm the director of DSS. And welcome, Natalie. Thanks very much for your willingness.
And I'm Mary Stebbins. I'm the deputy director for DSS.
I'm Alice Micklem. I'm one of the assistant directors. I have responsibilities over child welfare and our self-sufficiency team.
Wanda Horman. I am another assistant director, and I have responsibilities over our adult services unit and eligibility, and currently the front desk.
I am.
Oh, sorry, Tam, go ahead.
I'm Tamara Ryan. I'm the manager for the Office of Program Accountability.
And I'm Tammy Kreiser, and I'm the financial analyst for DSS.
All right, I think that's everybody. And of course, we have Lisa here. We have a lot of people here today. So really quick, are the members of the DSS advisory okay to do our elections for chair and vice chair today? Yes. Okay. I'm happy to make a nomination, but I'd like to hear what other people think if we want to talk about nomination for the chair.
I've been the vice chair, and I'm happy to serve as the chair if no one else wants to do it, but I don't want to serve in that role if there's someone else who really, really wants to. So if anyone really wants to, then feel free. It will not hurt my feelings.
I think it'd be great if it was you.
Yeah.
I agree. I think you've done a really great job.
All right. So does someone want to make a motion to nominate Mary for chair?
I can make a motion. This is Amy Loffer. I nominate, or am I making the motion? What am I?
Yeah, you nominate her.
Okay, I nominate Mary McIntyre to be the chair of the Department of Social Services Board, Advisory Board.
In a second.
I second.
All right, so we have Emily as the second. All in favor? Aye. And seeing none opposed, Mary will be the chair, and then we should do a nomination for vice chair, please.
So if I'm going to be chair, and that means I'm not coming to any more meetings. So whoever the vice chair is I'm just kidding. So we're going to need a good vice chair because I might not be able to be here.
I mean, I can offer, I guess I didn't mention, I think I've been doing this for either 2 or 3 years, maybe 3 years. I can't remember, I'm sorry, but I can do that. I know that Emily and Natalie are new, so.
Yeah.
Unless you guys want to do it, I'm okay with that too. Okay, I guess I
think you just nominated yourself. I think that would be great if you're willing to do it. I'm willing to do it too, but my intention is to have Anne find someone else for this. And it's been, I think, over 4 years for me, so it feels like the right time. So it seems silly to step into that position when I'm not have intentions to move along. So so can we get someone to make a motion for Amy to be vice chair, please?
I'll nominate Amy Loffer as vice chair of the committee or the board.
And a second, please.
I second.
All right, so that's Emily seconding Lisa, and all in favor? Aye. Seeing none opposed. We have Mary as chair and Amy as vice chair. And Mary, are you able to take over running the meeting, or are you still in? Or Mary, can you do that, or is it too hard for you?
I can try. I certainly can. Yeah.
Okay.
So I think next on our agenda, we have business from the director and the information items. And so Kaki, was there anything that you wanted to highlight to the board before we asked any questions that we had from the information items?
You know, I would like to highlight two things. One is that our strategic plan, which has been amended and revised, was presented to the full staff. While we maintained sort of broad commitment to the 3 bold goals that had been previously identified, we clarified some of the language in there and our intentions, and particularly with the second goal, which is around improving the diversity representation among our staff for DSS, both leadership and in specific mostly I think in eligibility, right? Is that where we were, in child welfare? I can't remember, but in any case, we clarified that it wasn't just a diversity goal in terms of hiring. It was in fact a goal around equity and inclusion and doing some important work around culture development within the organization. And we took a big step in towards that by having a first all staff meeting, all staff training around the ABCs of DEI, which I think was fairly well received. We continue to get good feedback, and it signifies an important commitment from the leadership team to keep this conversation sustained and to begin to look to behavior change and experience change among staff. So I just wanted to point those things out. Thank you.
Thank you. Did anybody have any questions or any comments about the informational items for this month? Natalie, do you have any? No? Okay. Emily, did you have any?
I'm just kind of getting my feet wet, but thank you. Mhm.
Well, we threw you in the deep end. So if you do need any explanations, or if you want us to slow down or whatever, I mean, I totally understand.
Yeah, no worries.
Emily, did you have questions?
No questions. I did just want to comment, super excited to hear about all the new housing news, and yeah, just really interested to see what comes of this upcoming meeting with the Board of Supervisors. I know housing is something that we've been trying to focus on. So that's, yeah, that part was just really exciting.
Amy, did you have anything?
Actually, I just want to say great job during that winter storm for all the adults that really struggled. I wish there was some way we could get the neighborhood involved with each of these cases. Anyway, any thoughts about that would be great. But the thing I wondered about housing was the Breeze Premier. What is that? And if it's not a big deal, you don't have to go into it, but.
No, it is a big deal actually for the housing office, because Yardi Breeze is both a client software and data management tool that has been specifically designed for HUD and for HUD regulations. And so shifting from our current system for client management and database management to this new system allows us to produce reports to HUD pretty directly, instead of having to do multiple steps of interpretation between what we have and what they want us to produce. And so it's been actually a long time coming. It does sort of necessitate a pretty big learning curve for the housing staff, but once they get that, it shifts the way that they do their work fairly significantly. So they're very excited to get started with that. And we can anticipate sort of freeing up some bandwidth for the housing specialists in about 18 months. And so then we can start to think about what kinds of quality services we want to provide that we're unable to now, because we're so focused on the sort of management software aspect of it. Pretty exciting. And to the neighborhood issue, we're so excited because the county's made a commitment to emergency services manager And so we now have somebody who's dedicated to helping us sort of prepare for emergencies, develop some operating guidelines around all kinds of emergencies, and then also will help us identify ways that we can help neighborhoods and individuals be more resilient for whatever the kind of disaster is. And so whether that's distributing flashlights and distributing water and sort of shelf-stable food for folks as we have this increased expectation that people are able to safely shelter in place for up to 72 hours. We know that's not the case. And so what do we need to do to help people get there? And then also improve our neighborhood contacts. And so that's one of the primary goals, I think, in the next year is to develop neighborhood relationships and then ways to distribute information to them to get to the more granular sort of house by house level. So it'll take some time, but it should change the way we are responsive to emergencies in the county. And that will help the DSS staff from having to be tapped every time there's one of these emergencies and we need suddenly 24-hour coverage somewhere. And the DSS staff is just extraordinary. They always say yes. They always sort of step into the fray, but it has a cost. And we had a situation I think you all are aware of in January where we had sort of competing interests for staff time. And we need our staff to be fresh and available in case one of those emergencies pops up and we can't have them scattered to the wind. We can certainly contribute to the county's response, but not be the sole responder. And so we're pretty excited about all of those efforts to improve our emergency responsiveness in the county.
That's great. Yeah, the computer story and somebody driving in a snowstorm to get the computers to the, geez, what an effort. It's like amazing work. So thank you.
I think actually Nicole is our super secret background host today, and she's the one who delivered that computer. So I'm glad you did that shout out today in this moment with Nicole hiding in the background.
Thank you, Nicole.
Where'd Jenny go? I was going to ask Jenny if she had any questions, but I don't see her. Okay, well, if Jenny comes back, I will ask her if she has any questions. I did, and I'm searching through, I printed it, so I'm old school. In item number 3 in section G, we're talking about the need to find local foster home placement for, in particular for LGBTQ youth, and that it just continues to be a challenge to find families and placement, safe places for them to go. And I'm wondering if we've approached, there's an organization called Side by Side Virginia. I'm not sure if you all are familiar with them, but they worked with Albemarle County Schools to provide training for school staff on how to best support, in particular, trans youth, but also LGBTQ youth and some of the clubs at the schools, the GSA clubs in particular. And so I'm thinking that that organization, I don't know if they could be used as a resource or if they might have recommendations of ways that we could connect with families that will be willing to provide a foster home, or even if it's short-term care for youth. But that was something I wanted to ask.
I know that our foster family support program that we contract with, CAF, has received training from Side by Side, but I don't know if they've specifically sort of sought strategies for recruiting foster families through them. And I'll let Alice answer whether Side by Side has been a resource that the county DSS directly has engaged.
I'm not aware of us engaging Side by Side directly in my time at the county. I'm not recalling that. So no, I would say just more generally, that's a specific need we have. And then just high acuity children, it's a enormous community need to have more placements available that meet their needs. For some children, it's really, they need a higher level of placement. And for other children, they just need a placement. They really don't need congregate care, but it might end up there because of our lack of local placement. So just across the board, I say it's an enormous need.
Would that be something that a board member could do, to reach out to that organization to ask if that was something that they could provide advice, or if they had any ideas just for resources? Would it be more appropriate for a board member to do that rather than a DSS employee? Or is that not something you think that we should do?
Given the fact that we contract for the service for foster family recruitment, training, and support, I wonder if we could just reach out to them and offer that as advocacy and support, and see whether that would be helpful for them. I don't want to speak on behalf of another organization since it's something we contract out for, but we could certainly do that. And we could also certainly look to side by side for internal training and support for the work that we do that isn't related necessarily to foster family. Thank you.
Another question that I had was in section 4, number 4, around letter B, talking about how you're all working together towards the pillars of high performance and that sort of thing. And it kind of spurred a question for me. I was wondering, as far as a whole united DSS, how many times do you, as the entire organization, have every single person in a meeting, like a one giant meeting where all the departments come together? Or does that even happen?
We have
Like
a monthly all staff meeting.
Okay.
And then we were able to do the DEI training at the same time as the January all staff meeting, but in the future, they'll actually be separate. So there'll be training for all staff that's separate from the regular all staff meeting. I don't know, Mary, are there other times in which the staff all come together that I don't know about?
There might be special occasions, but generally speaking, it's, special, there might be a special training, or like she was saying, or we might have we used to have wellness days where we would take half a day and go to, say, Walnut Creek or somewhere. So special things here and there, but really the monthly staff meeting is the time we're usually all together.
I would just add, it's not our entire staff, but all of the child welfare teams, also, in addition to the larger monthly staff meeting, we have a monthly child welfare meeting where all of those employees are together.
I'm just curious. I know just because you have a big meeting, it doesn't necessarily mean that it's actually productive or that it's necessary. We've all attended meetings that should have been emailed. So I just wanted to know how often that was happening across the department. So thank you for explaining that. The part about Nicole Jones, the employee who provided tech support and went to the county office building in the middle of the storm, that just caught my eye, because that's so important, and it made it possible so that other people could be taken care of and could do their job. And so we've had this come up before, where specific employees in the information items have been praised for something that they did that was over and above what the expectation was. And I know you all probably have some sort of internal way where you recognize those people and where they feel certainly valued, and that's important. But I was wondering if one of us, a board member, and I'm fine if it's me, just sent a message to that employee, perhaps an email or even a handwritten note, just letting them know that we heard about them and what they did and that we appreciate them. Do you think that would be something that would be appropriate?
I mean, appreciation is always welcome. Absolutely. And I think, for a team that I think has generally sort of felt under-recognized and underappreciated, I think this is that would be particularly well received. I should note that Nicole Jones is an IT employee and not a DSS employee, but that should not stop any one of us from celebrating the heck out of her for that Herculean task. So.
All right, then I will get with you, Kaki, to find out how I would contact her. Either email address or address is fine. Okay, I promise I'm almost done. The next one was about the housing, affordable housing. When we were talking about units being made available to renters at 60% AMI. So we're in number 6, section A, or home buyers at 80% AMI. It spurred a thought, and I was wondering if when someone is attempting to purchase a home at that rate in the affordable housing category, are we providing them or are we helping connect them with financing? Do we have community partners that have agreed or that we have kind of on a list where we can say these are community partners who we know are willing and able to work with you, or is everyone just on their own to find financing for that?
I mean, honestly, the answer is yes to all of those things, because we can't, we DSS and we, the sort of global sort of supportive community, we don't always know who's in need. And so there are folks who will sort of find their own way without bumping into any one of the supportive services that are out there. We hope that, of course, by the time they get to a formal lender, the lender is able to offer some support around financial assistance that might be in the sort of mainstream community. But there are a tremendous number of financial and sort of housing related navigation services available in the community, including Piedmont Housing Alliance has a really tremendously robust financial support system to help people identify the kinds of barriers that they would have to getting a traditional loan, addressing and repairing their credit, helping them identify what grants are available. And then, of course, there's lots of ways in which housing departments, not just Albemarle County, but others, support folks to purchase affordable homes, including sometimes we buy down we have a grant through HUD to buy down the amount of the loan to make it affordable in order for somebody to then get a traditional loan, or we supplement and support developers. And so one of the things that Emily had identified that's coming up on the agenda tomorrow is the first sort of pass at what developer incentives would be, so that we encourage developers to continue to build additional affordable housing units in a sort of wide variety of kinds of sort of targeted income levels, unless there's no way that the system of care can continue to provide enough support unless the units are being built. And so we need to find a way to support both the sort of financial need for buyers and also create the units out in the world. So when I wasn't being facetious when I said yes, it's sort of yes to all of the above.
Thank you. No, I appreciate that. I'm so glad to hear that we have all of those resources available. That's all that I have. Jenny, I lost you for a little while. Did you have any questions about information items?
No, I don't. Sorry, I might have to turn off my camera because I'm having trouble with my connection. So if I turn it off, that's the only reason why. But thank you, and I do not have questions.
Okay, so I think that's everybody. Then we can move on to the presentation today about the annual report.
So I'd like to divide this into sort of 3 sections. The first is a look at the actual report and to see if you had any questions or there were concerns that we need to make changes in that report. And we do have time to swap out the report for the clerk's office, where it's a month away, so we have time to make changes. And so the report is following the sort of traditional path it has just in terms of presentation and style over the years past. And then the second thing is to check in specifically around the letter that I've written on behalf of the board that's in the first section of that report, to make sure that that reflects what you'd like to say, if there's anything you'd like me to say differently or to add or subtract. And then the third is to have the opportunity to sort of look through the draft PowerPoint presentation that Emily has graciously agreed to do for the board, and make sure that that reflects the kinds of highlights that you would want to pull out, and make sure that you feel comfortable with that going forward. Am I missing some aspect? So why don't we start with the report itself? It was a pretty beefy report. Lots of charts and graphs. I really appreciate the work that Tammy and Tamara did to clean up the data this year. We often collect data internally, we report data to the state, and then we have our own reports, and sometimes they don't all match. sometimes they don't all match for really good reasons and sometimes for not so good reasons. And so this year, everybody on the leadership team sort of dug in to make sure that that data reflected something everybody recognizes the truth, which is really important. So I'm excited about that. But are there questions, concerns specific to the report?
I have a question on page 4, looking at this chart of key performance indicators. In this section, that is the second row from the bottom, it says on the left, children are successful in school. And then the next column, it says FS children do not have CPS reports of abuse and or neglect. But I'm not clear on what FS means. The only other place I saw anything F and S is up here, and it's talking about food stamp applicants. So what are FS children?
Family support.
So it would be clear if we could put those words somewhere close to where that abbreviation is, or we could put it just there spelled out, and then in the next column, when it is abbreviated to FS, it's clear what that stands for.
Okay.
Anyone else have anything?
I mean, I mostly looked at it with the idea that Emily would be presenting it. And I was thinking of how I had done it the year before, but those are so general. I can wait on my comments. If that's a good idea, Mary, that was very specific when Mary just brought up, but and Khaki, honestly, I didn't really look at the letter from the board that closely.
Okay.
So I'll have to actually read it more closely. So I can wait.
I am curious about page 19 under language assistance. It says number of language translation events. And I'm interested to know if this $33,898 is this majority spent in actual human translation or interpretation on the spot, or is that a lot of that spent in interpretalk over the phone? Because it might be interesting information to know if the vast majority of that is going to that phone service, interpretalk, versus paying a real live human from this community to do that.
It is a mixture and a combination. I would say probably it's almost 50-50 when I do the breakdown each month of translation over the phone as well as translation in person.
Then it probably doesn't need to be on the chart or anything like that if it doesn't illuminate anything that we really need to know. But I think maybe if you could add a phrase or a sentence or something that just says that you use them about equally, then I think that would be good. Because I wonder if we looked at our translation budgets over the years, how much that has changed and what we could anticipate for the future. It would just be good to be prepared to pay attention to that, I think.
Okay.
Those are all the notes or the suggestions that I had. If anybody else has any, please go ahead.
Just a comment while we're on that, because I hadn't noticed that before. So when we're talking about translation events, is this all spoken language? Because interpretation is actually a more accurate word. Translation is usually written language and interpretation is used for spoken language.
Good call.
It is interpretation as opposed to translation. You're correct, Mary.
Okay, so we should change that.
Am I overlooking the PowerPoint, Khaki, or do we not have that yet?
I didn't send it to you. We're going to go through it together today.
Sounds good.
I mean, I may have a specific thing. It was under the fatherhood on page 10. It doesn't refer to any numbers of people that are in the program. And only for a point of information, that might be if we do know how many people are participating in that program, that might be something worthwhile to put in there.
Great, that's easy enough for us to reach out and find out.
And the other thing, just based on what's happening with the foster care, you know, on page 11, maybe just a little footnote of the difficulties right now because of COVID. You know, that might be worth it. I don't know, Alice, if you think that is, but just, you know, that these settings, you know, don't really have emergency plans, and that's difficult for the staff to deal with.
That's true. And just FYI for you all, currently there are 4 dads participating in the group. I don't know what the total's been for the year, but that's the current number.
How many children does that represent? Maybe that might be compelling too.
That I don't know, but that's a great question.
I didn't have any like specific comments, Mary, that you were asking about in this section. But like Amy said, I had some things that were a little more general about having had that being, I think, 2 years I presented the report, and so I can hold those comments or whenever they fit into the discussion. One question I had was, for this report, is there a printed, the full version that the board will get? Or do you guys like email them an attachment, or do they get a hard copy?
Well, it will for sure come as an attachment to the board agenda item. And I don't know what we've done in the past, either the past or the most immediate sort of COVID past, when we've been doing virtual,
Yeah.
whether this gets formally printed or not.
Well, Lisa might know. I feel like there's been different ways to do it. And just, I mean, obviously doing it one way doesn't mean it always has to be that way. I know one year we had something that we, like the whole report went to the board as an attachment, but there was a more abbreviated version that was like kind of followed along with the presentation more, where you aren't highlighting every single graph, you know, because you have this limited amount of time. I feel like one year we were able to hand them that, or, you know, they had a hard copy of something that sort of went along with the slide deck that Phyllis had.
To your point, Jenny, my PowerPoint is not designed to follow along specifically with the report. It actually pulls out what I think are compelling numbers, and they're categorized in the kinds of service we offer, the sort of broader, sort of higher picture. So, and you guys may decide that that's not the way you want to do it, but I felt like I wanted to sort of do almost like a DSS by the numbers kind of presentation for folks. And so that may or may not dovetail with, may make your question bigger or smaller depending on what we do with PowerPoints.
Okay.
Yeah.
No, I like that idea, because I think you know, the information's there for anybody to go through all of it, but when you have this certain amount of time to present, I think it makes more sense to have more time to fully explain the things that you want to lift up, you know, the real compelling parts. So.
And I think one of the struggles, and small s struggles, that we had in sort of thinking about how to present this is that DSS does extraordinary work, and that's really clear. And we do it well. We do it well for our own measures. We do it well for state measures, and we're also struggling. And so being able to say both things, we do a good job, and we're really struggling to maintain that pace and maintain that impact, and be able to say that out loud in this context, and not just say everything's great. because it's not great. And, you know, one of the things we've seen is this sort of, particularly in eligibility, this escalation over the last 3 years of cases. You know, it fills that sort of division with fear and panic to see how far that line's going to go. You know, is it going to go like this over time and we're going to say, whew, or is it just going to keep going? And given the sort of state of our economy and our world, it seems more likely to keep going like this. And so, and that plus policy changes expected at the federal level around whether we can close cases when and how, that will increase the workload required for the eligibility staff just tremendously. Anyway, so I think it's worth trying to find a way to say both of those things in the course of this presentation without being too big of a downer and without also being too rosy about what it is we're presenting. So anyway, that was sort of one of the conversations we had leading up to this.
I would just add the additional context that when we submitted our resource capacity request to the county, and Kaki, correct me on the number, but I think we asked for like around 16 positions or something. And I just mentioned that because that really underscores how broadly we have needs.
And our focus this year with our budget request was on trying to level set, to say if we're going to do all the things that we are being asked to do and to do it well enough so that we weren't suffering, this is what we think we need to do that. I mean, I think it was a source of some panic for folks in the county executive's office, but it was also really important recognition that that often we have little pockets of suffering within, but in general, sort of most units are doing okay, except for this one right here. But that has not the case. The sort of steady erosion over the last 3 years has really affected almost every unit, and so that was reflected in our budget request this year.
Yeah, I think I'm just talking generally again, like the things that I was noticing is that the percentage of cases that are actually being found, you know, like the ones reported and then found, it's much higher than normal, you know. So I think that's really important to highlight, you know, that maybe we had more requests before, but there's fewer that were actually found to be eligible. But now almost everything that's being, you know, brought to us is being found eligible, you know.
And for eligibility, we face this issue of caseloads, and for child welfare, we face this issue of increased acuity. And so the complexity of the need and the intensity of the need is so much greater. So the sort of doing it by the numbers in that case doesn't really reflect the kind of work that's involved. And of course, you all already know that our child welfare units strive to take a best practice approach that takes more time and more effort and energy than just doing the baseline child protective services requirements. And so again, sort of meeting our expectations, meeting the state's expectations, and then doing what we think is the right thing for the community takes time and effort. And I will say that, you know, one of the things I should have highlighted from the notes, informational items, is that our CPS unit is fully staffed and has already recruited one person from the 3 positions that were granted by the Board of Supervisors in December, in mad recruitment for the other 2 positions, and has taken over their responsibilities that were farmed out to other units back to their own unit. So that's a very exciting transition and a long time coming for them and the other units that were supporting them. So that is cause for celebration for sure.
The only other, my computer's going to die, I'm sorry. I was thinking also that some of these, you know, there is like over 2 or 3 years now seeing an increase, you know, just highlighting that, you know, I think is important. I also think that the view, you know, the fostering future, those are really great programs that, you know, are above and beyond, it almost feels, you know, even the fatherhood or the family preservation, you know, this is trying to be proactive, trying to, So those would be things that I might say during the course of, the report.
Should I pull up is it the right time to pull up the PowerPoint and walk through it? Yes, I see general nods. Okay.
Can I ask before we do that really quickly, is the adult services chart in the PowerPoint individuals receiving adult services? Because there was a major jump in that chart between last year and this year, and I didn't know if you were planning to explain that to them or not.
There's not a chart, but there is an identification. So maybe it will meet the need. Maybe we'll need to add extra words to it. So let's see.
Actually, before I forget, I think it's also important to mention the amount of money coming in federal and state and how, it is a lot of money coming from the locality, but the truth is the matching is so much lower than, we're getting 176 million for entirety, and then the match is 8 million. And then it's 10 million for social services, and it's 4 million locally. So I think that's an important number to mention.
Agreed. It's one of my most exciting additions to this presentation, that the amount of money that we leveraged. I'll walk through it. So I've identified the members of the advisory board for fiscal year 21. Is that the right thing to do, or should I identify the board members that are current, or should I put them both? Because we have new faces.
I think we should put Emily's name on there.
Okay. So
they'll be like, what?
I'm going to identify, but I'm going to find a way to identify both in this list. Okay. And I'm using,
you can do both too, because I think it's good to acknowledge the people who served who aren't
agreed.
Still here, but so you can do like a term and ending date or something. So they'll understand.
Yeah, good call. And I just pointing out that I'm using the new PowerPoint template developed by our communications team. It was really easy and nice to do that. And it also kept me from being too frivolous, which I want to be. Our theme is a creative pivot for community well-being. And the total number of folks we serve this year is 23,977. And so that felt like a big number worth talking about. And so you can see our created this in some themes. So DSS focuses on helping the most vulnerable. So we had 687 community members receive supportive care through adult services, 4,226 community members enrolled in SNAP. CPS received 826 referrals and validated 378 of those cases. 14,945 people enrolled in Medicaid, staggering. 2,182 uninsured UVA patients got help in securing benefits, and actually the amount of the financial amount of those benefits is certainly in the millions for UVA. 1,313 households received energy assistance to keep their homes cool or warm. DSS believes youth do best in families. 109 families with 514 people received critical family preservation services so everyone could stay together safely. On average, 83 families received community-based supportive services to build their resilience every month. 75% of youth identified as imminent risk were able to stay with family or friends through diversion efforts or kinship care placements. We are a star on the state level on this front. 13 adoptions were finalized. DSS supports affordable housing. 394 families per month received financial support through a housing voucher. County staff worked in collaboration with the HCD and Habitat on Southwood Neighborhood Initiative. The county adopted a formal affordable housing policy, which is amazing. 22 housing vouchers were awarded to Virginia Supportive Housing for permanent supportive housing component of the Premier Circle Initiative. All of that, of course, will make sense to the board because they've approved all of those things. DSS helps people find and get living wage jobs. 166 people received financial and job training support through VIEW, provided job leads to over 500 job seekers, and targeted support to the community, including a job fair for women experiencing homelessness, Zoom sessions for Region 10 clients, and outreach in Southwood. And we achieved the designation as an official affiliate, a one-stop of the Virginia Career Works of the Piedmont, which allows us to expand and collaborate in terms of the services we provide on site. DSS leverages big money. DSS leveraged $8,085,131 in local government funds to bring in $176 million in state and federal funds for Albemarle County residents. And so that means we're not only leveraging this money to provide services, but we're also stewards for this money. A lot of this money actually flows through us, which just has an administrative burden that is worth mentioning. DSS collaborates, and so I'm certain that we'll add to this list, but these are all the sort of collaborative efforts that we have staff actively involved in, including the Thomas Jefferson Area Coalition for the Homeless, the Charlottesville Area Alliance, which is a misnamed coalition focused on senior services, making this a livable community for all. Community Mental Health and Wellness Coalition, Evidence-Based Decision-Making Group, which is again a misnamed group that focuses on criminal justice reform issues. Piedmont Workforce Development Board, the MAP to Health Leadership Team, UVA President's Public Health Working Group, Marcus Alert Planning Group, Reentry Committee, Greater Charlottesville Trauma Informed Community Network, and the Greater Charlottesville Early Education Coalition. We're flexible and resilient, but it's taking its toll. Nearly a fifth of the DSS staff left their jobs in the last year, most because of stress. Significant numbers of people were out on family medical leave. We're struggling to keep up with state standards while under stress and understaffed. Eligibility units are facing 50 to 62% increases in cases. Child welfare units are facing a significantly increased acuity in the cases they support. And our biggest tool is building trusting relationships, which is very hard in a global pandemic. While we have been flexible and great, it's tricky. DSS is focused on the future. So, and this is, I think, a really important thank you very much for supporting DSS for the 3 full-time staff for CPS and the mid-year adjustments and the 2 flexible overhire positions that were added mid-year. And our strategic plan is amended to include 3 primary goals: supporting community members in securing living wage employment, ensuring that DSS is an inclusive and welcoming place for all, and recruiting, training, and retaining high-quality staff. So those were the highlights that I picked up and that we sort of workshopped internally. So I'm going to stop sharing and get your feedback.
Is there any way to take out the word overhire? It just feels like
I know it doesn't really work, does it? I can just call it flexible hire or something like that. Okay. Yeah, overhire sounds like we're swimming in staff. So I know that's different from what's happened in the past. So I want to sort of generally take the temperature of the board to see if this is an okay direction to go in, whether you want to revert back to the sort of past method, whether this is bones enough to work, or maybe even to sort of present it in a different way that will, for those board members who've been around for a while, used to seeing it one way, will sort of hear it and see it in a different way because it's presented in a different way.
I think honestly, I think it's good to do it in a different way. I think it gives I mean, I don't know what you guys have planned as far as, you know, what parts Emily will do and what parts you would do. I always felt like when I presented it, and Amy, you can, you know, say how you felt because you did it last year, that it was, you know, essentially it felt like we were reading to them information that was available to them, and we were just selecting out the parts to highlight and then going through some charts and graphs. And, you know, honestly, it felt like, well, this information's there for someone to carefully go through. If you're going through it in 10 minutes, you're not really getting to see what those charts means. And it feels like maybe it's like you're doing it for the sake of doing it. I like what you're doing a little bit better because I feel like you're able to draw attention to, you know, kind of like what you were trying to talk about, finding the balance of saying, you know, the organization's performing really well, but you don't want to take away from the fact that it's very difficult and challenging. And, you know, there needs to be support for that work to continue at the high level that it's happening at. So I think doing what you're doing is a great approach because all the data is still there for people to look through, and going through it really quick. You know, people aren't fully getting all that information, in my opinion. You know, I don't know what you guys have laid out as far as like who would say what, how you want to do that part.
Yeah, we haven't had that conversation yet.
Yeah.
My instinct is to let Emily carry that ball, but we'll negotiate sometime soon, certainly before March 16th about that.
Yeah. Well, and the thing is, it doesn't have to be the same way
That's true.
it was always before. I mean, Phyllis would definitely highlight the things that she wanted to have covered, and then I would tend to go through and just sort of put it in my own words, because then it comes off, it just is more natural for me to present that information and not read what she wrote. And she was there to answer questions, but I did the main part of the presentation. I think Amy, you did it similar that way as well. Is that right?
Yeah, I'm really trying to remember. I think the board had a hard copy of the report. And I actually want to say, I think we went through each page. I can't believe that's true, but I'm pretty sure it is. And we just took out if it was going up, if it's going down, why would that be? So I love that you have numbers in here. 24,000 people are being assisted in our community. That's just like a really, that's just, okay, there it is. And then breaking down what services are happening. I agree. I do think having a nice little story, if you could, the story of the snowstorm and, Nicole bringing these computers, I don't know, maybe a different story, but like a story of what it's like,
I think it was originally in one of the informational items a couple of months ago, but the DSS staff community rallied together across units and across divisions to support a refugee family. That was really like a beautiful example of like instant responsiveness, collaboration across the agency, like doing the right thing beyond what our mandates were. And it was seamless and beautiful and rewarding for all of that staff. And I wonder if that's a good story for us to talk about, because it involves so many people from so many parts of our organization. And it continues to pay dividends, our involvement. We just recently helped to facilitate getting that family a car. And, I would hope that not everyone who's listening will immediately start calling DSS for cars, because that's an anomaly. But it is a pretty exciting and an amazing sort of story about what happens when everybody decides we're gonna rally together and use our skills and resources to the good. So thank you for that.
That's a great one. You know what else would be really good? If there's a client that had a particularly good experience. I know we've read those stories, but someone saying, this person meant so much to me. I know you always include them. I think that's always really powerful too.
Okay, we can do some mining for that. Yeah.
Can I ask one question? It seems to me it would be compelling to add something into the slideshow about where projections are going. I mean, it seems to me that if you're already a staff that's really under stress and you've been seeing the numbers go up, I can see people dismissing that, because if they feel like, oh, the pandemic is going to ease, it's, things are going to ease up. So maybe some of these stresses on the staff are really going to decline. And I say that because I know for us at TJACE, we are being inundated with refugees and pre-literate and illiterate refugees who have incredible needs. And so I think our community that's taking in all these refugees is going to have an increase in the services that are demanded. And so I think it's important, if there was a way to project out, we're going to see some of these needs rise in these areas, and this is why. I think that would be a really good way to showcase why it's important for the Board of Supervisors to continue to support you and to hopefully provide more support for more staff.
Certainly it would be, it feels foolhardy to even think about sort of making any predictions for the future, given the changeable context we live in. But we are tracking stressors, and we're tracking the stressors that lead to the kinds of need that we would then see clients around. And that would certainly be easy to sort of track stressor changes and population changes. Our population is aging. There's a bunch of things like that that would, I think, provide critical contextual information. That's a good call. We can certainly add that in there.
So is this the one time this year or for the next year that you're going to be presenting to the board? Or is it if you needed to speak to the board as a department later on for a reason, is there something where you could request to speak to the Board of Supervisors later or not really? Because I'm wondering if this is your one time, what would be the one thing you really want them to remember from the presentation? And whatever that one thing is, because I had trouble figuring it out, make it more obvious.
Yeah, thank you for that. I will say that that I think the leveraging the money is the one message I want to send, which is that for the small amount of local dollar investment, it has really big bang for our buck for the community. And that is without us in that role, that money doesn't come in. And so for me, it's not as feel good or sexy as some of the other things, but it is something that I think is really critical to deliver at this meeting. So I'm not sure that everybody would agree with that as the sort of the big, the one big message, but I know that's going to be new information for them. They haven't seen it in that way before. And so I'm excited about the punch that slide comes with. And I think actually the contextual information, having not included it, but now having Natalie brought it up, I think is really critical because then it sets the stage for the sort of future. And we'll see the fire department and the police department have now worked out 5-year budget plans. So while there's a requirement that they make a request every year and go through this process, they have identified based on the current stressors in the environment and population and where growth is happening in the county, what they're going to need in 2 and 3 and 4 and 5 years. And so that allows for some planning that's a little less reactive. And so one day when we grow up, it would be great to do the same thing and to be able to say, there are some things we can do some predicting around, and we anticipate that that we'll continue to have additional needs next year and the year after and the year after based on this context, as opposed to having the sort of, I think might be a more traditional view of the DSS as like a static number of people that they need in order to deliver all the services, regardless of what the context tells you. Anyway, so I think that would be worthy of thinking about. And it is the only time we have to collectively for the board and the staff to come together to present to the Board of Supervisors. We certainly will have an opportunity to have some rich conversation during the budget work sessions that are coming up. We'll be able to speak directly to our needs and our concerns then. And I think that the advisory board probably is the single sort of best conduit to the Board of Supervisors for any future conversations that are sort of outside of the administrative cycle that we're involved in. So if there was an issue that you all wanted to talk about, you could make a request for time in a Board of Supervisors meeting and then let the Board of Supervisors, your representative, figure out whether that's a good call and how to put it on there. If there were something like that, like an action item or a workshop item or something like that. But otherwise, I think that messaging is more sort of informal in your sort of check-ins with your representative. Lisa, can you see and how close in proximity our next meeting is to our March 16th presentation? You're muted.
The day before, it's March 15th.
Okay, so that's going to be too late for making a whole lot of changes. So Tammy and Tamara can make the changes to the report, and I'll make some changes to the slide deck. And then send it out for your thumbs up around that issue, and particularly just pay attention to that letter in the front that is different. It's like the only sort of significantly different sort of language from year to year. So just make sure that's okay, what I've written on your behalf there. And then we'll, once you guys have given me the thumbs up electronically, then I'll send that report on to the clerk's office for inclusion in the board packet. And then the slide deck, Emily and I will go through and wrestle over who says what, when, and then send that to the clerk's office. Usually a day before is fine with them for PowerPoints, just to have it stacked up in their big deck. But I really appreciate your review and your feedback today of really great changes and suggestions for the report and the PowerPoint.
How much time do you guys get again? Is it 10 minutes or?
I think it's
15?
20. I think it's
Okay.
20 minutes. I asked for a half an hour and I noticed they scheduled us for 20. So we'll see. Yeah.
Well, it seems like when you go through it with Emily, you know, if you had some things that you thought about adding, or wanted to spend more time on something like what Mary pointed out, like what's the one thing you really want to have them take in? Maybe if do you feel like there's the time, you know, and your judgment on, is it make it more powerful to add a little more information around that topic, or is it too much? Or, you know, I don't think it would be. Maybe you find that you could add that you have more time than you thought. Because I don't know if I mean, I think that includes them asking questions, but in theory, they may not. A lot of times in the past, the type of questions they ask is like, go back to this other slide because you just showed like 15 graphs and charts and buzz through them. And so they would have us go back to one and ask a more specific question. And I don't see where your presentation would leave them scratching their heads at any part of that. So maybe make up some time because they don't have questions. So you could add in another slide or two.
Well, we'll certainly add in the slide with the stories. And if we find some good client feedback that we mine, we'll certainly add a couple of those things. And if we can add a slide around context and the sort of how that context influences our predictions for the future, I think. So we've got probably 3, maybe 4 slides to add that will provide some important, rich basis for conversation. Cool. Thank you all.
Okay, I think that wraps it up unless anybody had any other questions or comments. Thank you so much for the presentation on the annual report. It is always impressive to see these reports every single year. When I read them, I learn something new. Every meeting I come, I learn something new. So I hope you all are proud of all the work that you put into the report, and please let all of the staff know that we really, really appreciate it. And I know the Board of Supervisors, I know they're going to read the entire thing and probably have really good questions too that we didn't even think about. So thank you so much for that. We are going to move on to the business from the board. So if any of the staff who were here to present to us would like to go, you're certainly welcome to go. Thank you for coming. It was really nice to see you all. Do any board members have any business that you would like to share? No? Okay. I had one thing, surprise, I had something. I would like to ask, so I was emailing with Lisa over the last 2 days because I noticed on a lot of online lists of community meetings, information meetings, forums people can attend, things like that, that we weren't listed on them, the DSS advisory board. And so I don't know how we get on those. I don't know if people just go through all the websites and pull them themselves, or if we have to actually advertise and send out our information about our meetings to make sure we get added to lists. But if we did that in the past, I think it's probably time for us to make sure that we do that again, because I want to make sure that the community is aware of our meetings, knows how to access them, and that it's easy to find. And so in the course of me like trying to figure that out as if I was a stranger who didn't know anything about the board, I kept looking at the website and I couldn't find the link or the information of when and where the meetings were. And then Lisa and I got that figured out. So I was refreshing an old web page and not the new version of the web page. So the meeting did appear yesterday on the website, but that's still only 1 day in advance. So I wanted to see, like, I don't know what the public information laws are for for appointed board meetings and things like that, but how far in advance do we need to make sure we're providing this information to the public? Jenny, you might know.
You know, I think I was actually, when you were just talking about this and earlier, I was thinking about something else that I'll add since we're talking about that, but I think I don't know, I want to say it's like a week, it's like 5 days, like for planning commission where they notice our meeting. And I mean, if it's a standing monthly meeting, they should have that listed, but then notice the meeting. So there's like a set agenda so people can learn, we're going to talk about this specific topic, so that it's not just a reoccurring meeting, but you notice, the county should notice the meeting. I think it's like 5 business days ahead. For planning commission, I think it's like a little over 5 days, and then they notice, so it's specific to those topics, so that community members can know that they should show up if they want to speak or hear us speak about those topics. And that got me thinking too, when Kaki was talking about sending out, like if you send out the presentation with added slides, and we should be careful about like replying all, and like having a meeting through email is something people accidentally do all the time. And you know, it's obviously a much bigger deal with some groups than others, but technically we shouldn't be doing that. And then, so in a situation like that, where you want feedback from the group, everyone should just respond directly to, you know, Kaki or Lisa to say, you know, I saw that, looks great or whatever, and not have it be something where we're all talking and emailing in a connected thread.
One of the things we can do is ask for guidance and an opinion from both our attorney's office and also from our communications office to find out sort of what's possible and then what's advised. Because we're an advisory board, there are some requirements, but they're less than maybe the planning commission. So anyway,
Yeah.
I think it's worth asking our internal experts on some guidance for both how we make sure that we're being as transparent and public as possible, and also following the rules around that. So I promise we can do that before our next meeting.
But I think it's easy enough for us being advisory to have it noticed, like we always meet at this time every month, and then maybe Emily could help you with like the communication part, where if it's helpful to the community to know we're going to have a presentation about housing, you know, which isn't something some people might think about, you know, coming to DSS advisory to hear, and they're interested in that, then they could come and, you know to come to that specific meeting. I mean, it would be kind of nice to stir up some attention too, in a good way, good attention. Always the good attention. So
I try my hardest.
But I think that's a cool way for people to think, oh, I'd like to learn more about that, and come and hear the discussion, see the presentation where you dive into different aspects of the agency.
Thank you. So good. We'll work on becoming more visible and making sure we are posted online, whatever it is we're supposed to. And if anyone else sees any list of community meetings or community interest things, and if you see that we're not on there, you probably could just contact them yourself and be like, hey, the DSS advisory board meets on the 3rd Tuesday of the month at this time on Zoom, and they'll probably add it. And that might have to be the way that we get on the list that are going around. So I'll do my part. Was there anything else anybody wanted to bring up? So then I think that we just have to make sure that we discuss anything you wanted included in a message out to the supervisors this month from today's presentation. Although all of today's presentation should be talked to the Board of Supervisors, but not before their presentation in March. So what should we highlight?
Read the report.
Read the entire report to them. No.
Yeah, maybe we just say the discussion was the annual report, which you will be receiving in March.
Sounds good to me. All right, well, is there anything else before we adjourn until our March meeting? Okay, our next meeting is Tuesday, March 15th, 3:30 to 5 p.m. on Zoom. Thank you so much, everybody. We'll see you then. Bye.
Welcome, Natalie.